Welcome back, viewers. Thank you so much for tuning in, and really appreciate you joining me. And if you are new to the channel, just know that on this channel I do deliver content on social work, more specifically on working with children, is that's my bread and butter, basically. In today's topic, I'm just gonna give 10 quick tips in terms of how you can swiftly progress your child and family assessments if you are in a duty and assessment team. These are nuggets from my own, experiences, interacting with social workers, within the field, in my 20 years of experience, really. So I don't claim to be a guru in this field, but I just like to share information from my own experiences, and I hope it's gonna support somebody else to advance their career. Basically, that's the main purpose of why I deliver such kind of content on this channel, really. And for those who are new to the channel, my name is Patrick Tauya Matope. And, like I said already, I do deliver content on social work on this channel. So, in today's video, I'm just going to give you 10 tips on how you can swiftly progress your child and family assessment, while it's working in the duty and assessment team. One thing I'm just gonna say off the bat straight away is that working in a duty and assessment team, sometimes the caseloads can be high because it depends with what you get on that particular period of duty that you are on duty. I've worked in local authorities where you are on duty half of the week, and then the other half of the week the following week. And then I've been in other local authorities as well, where you are on duty on specific days of the week, and then you kind of alternate. And then, I have also been in other local authorities where you are on duty basically 1 week. It could be 1 week every month, or 1 week every 5 weeks, or 1 week every 6 weeks. It depends with how many teams there are in your service, basically. Obviously, we work with tight time scales, and sometimes the duty week, like I said already, it depends. Sometimes it can be 4 weeks, sometimes it can be 3 week, sometimes it can be, 3 weeks is kind of unrealistic, really, if you look at the work that we do. But I know sometimes it's 4 week, sometimes it's 5 weeks, sometimes it's six, sometimes it's eight. Depends with which local authority you're working in. So one thing I'll say is you need to move swiftly, with your cases, and you need to be staying on track with the tasks that needs to be done. So I hope these 10 tips I'm gonna give are gonna help somebody out there. First and foremost, what I'm gonna say is, first and foremost, point number one is you need to front load your information gathering. What do I mean by that? You need to start gathering key information immediately you get that referral. And sometimes if it comes as a referral which needs a strategy discussion, pay attention when you're in the start meeting, because some of the information being shared there, it's some information that you can also actually use in your assessment. So you need to make sure that when you're attending a start, you pay attention. And if it comes in as a Section 17 assessment, as a normal referral, you need to make sure that once you get the referral, read through the file. Don't wait, for a formal visit for you to get a full picture of what's going on. You need to be checking all the records, previous referrals, previous CP plans which were in place, previous child in need history, early help involvement. That will give you a true picture of what's going on, and so that when you can actually even start working on your chronology before you even do the home visit, so that when you go to the home visit, you just carry your chronology and you're able to check your information as contained in your chronology, and actually make sure that that information checks out when you have a conversation with the parents. And if it's something that you need to confront the parents about, you are able to do that because you've got all the information, rather than being in a visit and then they're telling you information you have no clue about what's going on. So you need to dig deeper into the file and get your information straight away. And while we are still on the point of front loading your information gathering, make sure that you contact professionals early as possible. I'm talking about your schools, your health visitors, your police, your early health practitioners, to make sure that you actually prevent any delays that could be there, really. Point number two, you need to prioritize and plan your initial visit. Prioritize and plan your initial visit. What do I mean by this? Make sure that you complete your visit, a first home visit within the first 48 or 72 hours. Remember, if it comes as a Section 17, referral assessment for assessment, you need to see your children within 3 working days. However, if you've gone for if it has gone for a strat and it has been agreed that it needs to be Section 47, they need to be seen immediately or within 24 working hours, basically. Sometimes it doesn't necessarily mean that, if it's a Section 17, you have got the leeway to see children within 3 working days. You wait for the 3 working days. It depends with what concerns they are there. If it is high risk, for example, extrafamilial harm or suicide or ideation, whatever it is that's going on, make sure that those high risk cases you prioritize and you actually see the children as soon as possible. Whilst we are talking about issues around prioritizing and planning your visit, make sure that you have a structured plan for your visit. If it means you need to jot down some strategic questions that you may need to be asking the parents, jot down those questions so that when you go into that household, you're not going to get stuck in terms of what it is that you need to articulate. You need to be able to know exactly what you need to be talking about on that particular first visit. Speak to the child alone, assess the home, environment, and engage the parents. When it comes to engaging the parents, remember some of the concerns which are there. If it's, for example, domestic abuse, you can't engage the parents when they're sitting next to each other. Sometimes you may need to be seeing one parent on their own, another parent on their own, sometimes in the office, to make sure that you get a true picture of what's going on. And remember, when I talk about speaking to the child alone, make sure you have used some direct work tools. There's a video separate. If you check, on the log of the videos, there's a separate video which talks about direct work tools, so you can actually go back and actually check that. You also need to make sure that you gather the child's voice early in the process, so that you don't delay and that doesn't delay your assessment, basically. And point number 3 is to use every interaction efficiently. Use each and every interaction you have with the family efficiently. Whether it's on a phone call or whether it's through a visit, you need to make sure that you have used that interaction that you have with them efficiently, in the sense that you gather all the information that you need at one go, rather than getting this information and then follow up with a phone call. And because sometimes sharing of information, it depends with where the parent is. Sometimes you call them, they're in the shop, they're not able to talk openly with you. Sometimes you call them, they have got visitors, they're not able to talk with you nicely, but you've actually missed the chance where you've had the first visit, that's the reason why I'm saying you need to plan and prioritize such kind of visits. Because when you go unplanned, that's when you realize that you've forgotten to ask about this, you haven't asked about this, because you haven't actually planned your visit. And each visit that you do, remember, you don't have time to do visits twice or 3 times or sometimes 5 times, as our colleagues in the safeguarding team may actually do. Sometimes you need to make sure that each and every visit or each and every call you have with the parents, you're actually moving the case forward. You're actually progressing something within the referral. And ask targeted questions, clarify any missing information, and set clear expectations for the families, so that by the end of the assessment, they are clear in terms of what the outcome can also look like. Don't wait for the next visit to ask something that you could have covered in the first visit. Rather, grab the phone, make the call, have that conversation, and record what needs to be done. Point number 4, don't delay difficult conversations, because obviously, if you delay such kind of difficult conversations, if you wait until the end of your assessment, it will be difficult for you to actually convince the parents whether it can be worked under child in need. You may not necessarily need to be escalating things that don't need to be escalated, but if you have those difficult conversations early on with the parents, be clear about the possible outcomes, you'll be able to actually sail through with your assessment, and it will be easier for you. And if there are concerns around parenting capacity, for example, issues around ensuring safety, and if there is neglectful parenting going on, and try to make sure that these concerns are addressed, early on. Try to point out what the parent needs to do to change the situation, so that they are aware of what needs to be done. Sometimes if they start to adopt those changes, it's possible that by the end of your assessment, you actually recommend the case closure, because changes have already been implemented. You have already started to realize the changes that you want to see. So it's possible that towards the end, you can actually recommend closure, because work has already been done while you are progressing the assessment. Be clear with families the next steps, what it is that's going to happen after your assessment. What in terms of the expectations, consequences of of them not engaging. Be clear with them and making sure that they are able to address some of those issues early on. Point number 5, remember multi-agents working is key. So do your agents checks as soon as possible. Chase up agents checks, responses quickly so that you don't delay. If you have got a 5-week cycle, those 5 weeks can go just like this in a click. And by the time you realize next week is going to be duty, you've got a whole load of assessment that needs to be written up. Yeah, I'd rather you make sure that the first week you do agents checks, you do your visits, you do everything that needs to be done. The following week you are gathering all the information, starting up to think about, okay, which one should I prioritize. If the assessments that are coming through your first visit, first conversation with the parents, and you are convinced that it's a no consent assessment that needs to be done, have that conversation with your line manager within the 10-day week, supervision, and then you are clear on what needs to be done, and you can actually start writing up those ones. The moment you see your numbers going down, it motivates you. You get that motivation to know that you need to be progressing your work quite early on as well. And use professionals meeting to ensure that you align perspectives from professionals and also plan interventions, and you enable professionals to actually see your thought processes, and they're able to see what it is that you're planning to do with this with this referral. If an agent is unresponsive, escalate your concerns through their safeguarding leads so that you get your responses quite early on, really. Point number 6, keep your assessments very analytic. You don't need to be writing chapters and verses. Make sure that they are quite analytical and not descriptive, really. Because sometimes if you go down the route of descriptive too much, you put in lots of data which may not necessarily change anything. But at the end of the day, it's about articulating the most important things that you need to actually bring out in your assessment. Because remember, if the assessments are quite too long and so forth, even the parents may struggle to actually follow what you are trying to say there. You need to avoid excessive narrative writing and focus on the analysis. And you also need to ask yourself, what does this information mean for the child? Everything that I've received so far, what does it mean for the parent? What does it mean for the child? If the parents are not living together, the resident parent, what does this information mean for them? For the non-resident parent, what does this information mean for them? What are the risks? What are the strengths? What is working well? What's not working well? What are the complicating factors? What needs to change? How can that change be realized? For us to see that things have changed, what are the signs? What is it that we need to see for us to be convinced that change is actually happening? You see, you need to use clear evidence to justify recommendations, making sure that your rationale is quite clear and why you are recommending what you are recommending. If you are recommending case closure, why are you saying case closure is proportionate at this point? Why are you saying case closure is justified at this point? You need to be making sure that you are quite clear with regards to that. Plan ahead of your, in terms of gathering your information, and you need to complete your assessments within the cycle given. Sometimes most local authorities are now sticking with the 25-day working cycle or the 30-day working cycle, so that you make sure that your assessments are done on time, and this prevents that last minute pressure that comes within the duty and assessment team. And don't hold on to cases unnecessarily. That's one thing I'm going to say, because it's not going to change anything. If you hold cases unnecessarily, your manager knows exactly what you've discussed in supervision. They know the capacity that you can actually have. So there's no point in you holding on those cases, because you're still going to get referrals. You're still going to get cases allocated to you. By the end of the day, if you work your cases through, you see your numbers coming down, it motivates you to get your things done. I always give people a tip that when you work through your cases quite well, even a week before duty, you can actually have the luxury to take your toil, take time off, and be able to do other things that you need to be doing before you go back to that busy duty week again. If it needs to transfer on a child in need plan, get that transfer as soon as possible. If the agreement is that needs to go to ICPC, get that work done as soon as possible. There's no need to delay. There's no need to be to procrastinate as well. Book your case discussion and supervision with your line manager within the 10-day period, which is expected by I'm sure, understand most local authorities, that's the expectation in any case anyway. If you are stuck consult with your line manager, consult with your senior practitioner, so that you get the support that you need. If you feel that the visit that you're supposed to be doing, in terms of your own risk assessment, you need a colleague to go out with, ask who is on duty. Think about conversation with your senior practitioner to agree, if your senior practitioner can actually support you on that, or you need to go out with a colleague, or you need to go out with your manager. Think about that as well. And when it comes to the templates that is used in most local authorities, it's important to adhere to that template. But besides adhering to the template, make sure that all the subheadings within the assessment triangles are covered. When talking about this, most managers, I'm sure they don't, take a, take you to task to say I need to make sure that all the subheadings they are there, but make sure that all the requirements within those subheadings are articulated in your assessment, and that information is actually included in your assessment as well. Remember, when you do your assessments, not all cases will need long-term intervention. If it's going to be, a short-term intervention, get it done, send it over to where it needs to be going, so that you create space and you are able to actually breathe and do and focus on the work that you really need to do with some of the cases which are actually open to you. And in terms of your escalation, check in with your colleagues. They've been there, especially those who have been there for a while. They will guide you in terms of threshold analysis, and read your threshold document. If you're not quite sure as well, go back to it and make sure that your recommendations are based on evidence. They are based on threshold document, and you're able to actually articulate that. Remember, cases are quite dynamic. Risk, assessing risk is an ongoing thing. Things do change. Don't get rigid on the same viewpoint that you had yesterday. If you know that you've received new information that may change the face or the complexion of or the complexity of that particular case, speak to your senior practitioner, speak to your colleagues, speak to your manager, get some support, and you'll be able to have a clear outline of what you need to be doing really. And final thoughts, making sure that you get your assessments done on time is key, because throughput is one thing that a duty and assessment team is quite focused on. And I hope with those few nuggets I've just opened your mind in terms of how you can actually make sure that you progress your assessments swiftly within the duty and assessment team. Thank you so much for that. And if you haven't subscribed, please do subscribe, hit that notification bell, so that when I post, you'll be the first person to know. I really appreciate you. Thanks so much. Bye bye.